So we've talked about testing. We know how important treatment is. This is the chance now to move on to our vaccination campaign. The initial portion of our vaccination campaign was focused on healthcare workers, such as the people who work in our hospitals and the people who live and work in our congregate settings. We focused on our congregate settings because we have seen the majority of our unfortunate fatalities. Close to 70% of all our COVID-19 associated fatalities have been from our congregate living settings. And we focused so heavily on our healthcare workers because we are in a pandemic and we need our healthcare workforce intact, protected, and ready to go. With us now having identified one of the more contagious variants of COVID-19 in Rhode Island, we feel even more confident in this decision that we have made with vaccination. Our early, targeted, deliberate focus on these populations that I've talked about is one of the reasons why we feel a little more confident that we can loosen restrictions on visitation in these specific settings. As I shared earlier, Rhode Island has made great progress with our COVID-19 numbers. As you can see on the slide being displayed now, when it comes to daily hospitalizations, which is the metric we focus on most closely when thinking about reopening the economy, we have made more progress than the rest of the country just over the last month. We have also made more progress than the other states in our region. While the hospitalization rate in Massachusetts declined by 32%, and the hospitalization rate in Connecticut declined by 10%, ours has declined by 46%. Rhode Island's progress has been even more significant in those areas where our vaccination efforts have been concentrated. If vaccination report cards focused on this particular public health outcomes, hospitalizations, Rhode Island is ahead of the pack. For example, we have seen a 49% decrease in cases between January and February in the general public. That decrease has been even more pronounced among healthcare workers and among residents of long-term care facilities. Again, the groups that we focused on in a very targeted way with our vaccination rollout. To be clear, there are other factors in play beyond just the vaccine. Mask wearing and social distancing are huge, and we know that treatment with monoclonal antibodies is having a big impact, as intended. Also, the fact that we have worked so hard to make testing so accessible in all different settings throughout Rhode Island helps us identify cases right away and get ahead of any large clusters. But there is no doubt that our vaccination strategy is meeting the main objectives of the first portion of our vaccination campaign, which was to protect people in our nursing homes and other congregate settings, and to ensure that we have a healthcare workforce so people are here to provide the care if you or your loved ones were to need it in our healthcare systems. It's also clear that the targeted strategic approach of focusing so closely on certain populations has been operationally complex. We understood that. We had a limited supply. We needed to get it to these specific populations so we could have the greatest impact the way we have, but it has also taken time. It is much faster to administer doses at a central mass vaccination site than it is to bring vaccine to people where they live and to coordinate vaccination through someone's employers, like we did with healthcare workers. For that reason, when it comes to our administration rate, as opposed to the decrease in hospitalizations that we intended to see, we are a little behind some other states that have not been quite as targeted. So other states did not have the drop in hospitalizations that have allowed us to now be able to move forward with opening up visitations and to feel confident that our most vulnerable populations are protected. But those other states were able to get administration going of the vaccine faster. I understand why people are watching the administration rate in Rhode Island and in other states. That makes sense. It's important that we all center ourselves around understanding the data and understanding why, for Rhode Island, we chose the approach that we chose. We are trying to prevent hospitalizations. We are trying to keep people alive and prevent fatalities. And we are focused on getting the economy fully open again as soon as possible. At the end of the day, we will measure our success based on health outcomes. How effective were we at keeping people out of the hospital? How effective were we at keeping people alive? And I know that's what matters. That's what matters most. All that said, we've heard the feedback loud and clear, and we agree. We are there. We understand what the concerns have been. And so we said we, by and large, achieved what we needed to with phase 1, and it is time. It's time with our phase 2 to get our vaccination shots administered more quickly. We can be confident in the fact that the most vulnerable, those who really suffered the most, are protected enough, and it's time to get vaccines out to as many people as we can, still going according to the risk layout that we have shared previously: age, underlying illness, and geography, but going significantly faster. That's why we were so excited to launch our 2 mass vaccination sites this morning for the general public. One at the Dunkin' Donuts Center in Providence, and one at Sockanosset Crossroad in Cranston. General Callahan and his amazing team at the Rhode Island National Guard and people throughout our response team in state government have done an amazing job getting these sites up and running and getting up to 3,250 appointments made for day 1 just today. We have 10,352 appointments booked already for over the next week and a half. Right now, people who are 75 years of age and older can try to make an appointment to be vaccinated at one of these 2 mass vaccination locations. They can go by visiting vaccinateri.org, or if you cannot register online or are not as comfortable doing that, we also have set up an automated phone line to help with registering that way, and you can call 844-930-1779. Because of our understanding and the need to move quickly, on Monday, people who are 65 years of age and older can also start trying to make appointments. There are limited appointments available, so if you're not able to make an appointment, you should continue to check back over the coming days. Many of the cities and towns are focusing on their oldest adults first. So if you are in the 65 to 74 year age bracket, your best bet is trying to register on one of the 2 state-run sites or going through your local pharmacy. However, again, the eligibility timeline is the same throughout the state. We are very excited to be launching these new sites because these are high-volume vaccination clinics that are age-based for the general public, meaning that vaccine will get administered there much more quickly than vaccine for specific populations at the various different locations the way we had approached with phase 1. So we recognize what we did took time. We were effective in what we did during phase 1, and we know it is critical to speed up the process and get us going with people being vaccinated, and we have the capacity to do that through these large vaccination sites, as well as continuing to build out the pharmacies. As we look forward, our two objectives are continuing to get faster and get simpler. So what does that look like? We're focused on that. We understand it's time. As I said, running the mass vaccination sites will mean many, many more shots administered per day. We have the capacity to do hundreds of shots per hour at these sites. This is our model. More shots at fewer and more central locations. We envision standing up additional state-run mass vaccination sites over the coming weeks in other parts of Rhode Island. We also envision consolidating the clinics being run by the cities and towns to about 5 regional sites run by cities and towns. I really want to acknowledge the cities and towns have done phenomenal work doing outreach and getting their most vulnerable residents to local clinics. Similar to our phase 1 approach of being targeted and strategic, our cities and towns have really contributed to making sure that we have been effective in reaching those 75 years of age and older. Some of them have been registering for them, getting access to them, helping them get to the sites, working with the senior center to help ensure that our seniors 75 years of age and older have what they need to get vaccinated. That was important. We want the cities and towns to continue that local focus while also beginning to collaborate on our planning for regional clinics so that we can, over time, get more efficient as a state, which is what our goal will continue to be here going forward, continuing to get faster and continuing to get simpler. We are so focused on having fewer sites, because that's going to be key to getting faster and getting simpler. It allows us to cut down on the redistribution process. Redistribution is the #1 reason why it takes time to get shots into arms. When we started this vaccination campaign, for phase 1, when we knew we were being strategic and targeted, 14 days was the goal we had in mind for being able to get from the beginning, when we first order the vaccine after being allocated from the feds, to the end point when a vaccination shot goes in someone's arms. We mapped it out, and we said that around 14 days is the time taken to get us through that point. Those 14 days included us receiving the vaccine at a central site after it's been ordered and shipped by the manufacturer, coordinated by the feds. It also included then breaking down the vaccine into the right quantity for the proper vaccinator and then repackaging it again, all while meeting the vaccine's shortage and temperature requirements, some of which were complex. Then it involved us shipping the vaccine out to the proper vaccinator in Rhode Island. At times, that was one of the many municipalities, towns, and cities who has done a great job getting to our 75-year-olds. The vaccinator receiving the vaccine then had to work on scheduling someone for a clinic, because as I've said in the past, given our COVID approach, unlike what we had during the H1N1 pandemic response, you can't just set a time and have large groups of people show up during that time to get vaccinated. So taking the time to schedule it. And then the vaccinator administering the dose, which is often at a clinic scheduled over a few days, would then take place after the vaccinator received the vaccine. Most of our vaccine is getting administered within that 14-day window. However, we know that it's time to get faster. We are purposefully moving to that point of getting faster. The way we do this is by getting out of that redistribution business. We move from having that strategic targeted approach with multiple different vaccinators and partners and consolidate, streamline to a smaller number of sites that have the capacity to receive and store large amounts of vaccine. With that, we can make it so that the vaccine is shipped directly there from the manufacturers. When we take that redistribution step out of the process, we cut the timeline in half, from 14 days from beginning to end when the shot is administered to 7 days or fewer. That's what our goal is. As we consolidate our vaccination sites, we will be consolidating and also simplifying the registration process. So we started out purposely with multiple partners so that we could really get to our most vulnerable population and make it as easy as possible for them to get vaccinated. But we also recognize that that was at the expense of causing confusion. We understood that feedback about it being confusing to have multiple registration systems right now. While the pharmacies will always have their own registration system because of how that was required to be set up in partnership with the feds, we have a single registration system, one website, and one phone number for the state-run sites. And our goal is that when we consolidate our multiple municipal clinics that are focusing on 75-year-olds, once that is complete over the next several weeks, in time, those clinics will consolidate to just 5 regional clinics. And those appointments will also be available through the same centralized system that we have set up at the state level. And so there will really, between the 3 channels, just be going through pharmacies or going through our one centralized website or phone number single registration system that's run by the government. One other note I want to make about our vaccination campaign, and that's on equity. We have had a focus throughout this response on getting resources to the places who are hardest hit. We have talked a lot about the impact of COVID-19 on Central Falls, for example. For that reason, Central Falls was a place where we got vaccine out early. Roughly 20% of adults in Central Falls have gotten at least a first dose of vaccine. Since we started vaccinating there, case rates have decreased in Central Falls by 71%. And our test positivity has fallen from 22% to 5%. This is fantastic news. However, we know that we have much more work to do in some of our other harder hit communities. The good news is we have a template of what can work. Very rightly, people have pointed out that many of the communities where our vaccination rates are the highest are not the communities that have been hardest hit. We want the vaccination rates in every city and town to be high. But we also know that we need to catch up in some of our other more densely populated communities where there are higher rates of hospitalizations, particularly among certain zip codes. We know that, we're focused on that, we own that, and we have that as a major priority in the short term so that we continue to see the outcomes and the decreases in the disparities and the gaps that have been known throughout the pandemic response.